friends and colleagues and safety case specialist for the UK nuclear authority. And previous, he's still actually an adjunct lecturer for us in TU Dublin. Diego, the floor is yours.
Thank you, Kira. Okay, thank you very much. Yeah, so my talk is going to be a bit different to the previous two. What I wanted to do in this talk is trying to share, well, first of all, what do we do in the UK Atomic Energy Authority. I'm a safety case engineer there, so I will explain how I try to incorporate human factors, and also yeah, why we need safety cases, and yeah, and how we understand human factors there. So yeah, so first I will just give a bit of a definition of what is a safety case, then what is fusion, and then what are the hazards of fusion and how we integrate human factors into this field. So, okay, so I would probably skip a few of these slides. So our society now has very complex systems that with time they become more and more complex, and that leads to having more complex accidents, or it becomes more complex to identify what were the causes of those accidents. And sometimes it's due because there is no safety case in place. For example, in 2017, there was this fire in the Grenfell Tower, which was a 24-story building where people were living there, and there was an electrical fault in the refrigerator in the 4th floor. So that caused the fire, because there were no fire systems, safety systems in place, were properly working. The fire rapidly spread. Also, it went out of the window and started climbing out of the cladding of the building. So after all the analysis of the reports, it was found out that there was no actually a proper culture of safety in high-rise buildings, and also there was no legislation against using flammable materials in this kind of buildings. So as one of the results of these reports and this analysis was to actually, the HSE issued a guidance for safety case and for high-rise residential buildings. That was done in 2023. So this is a good example of the implementation of the safety culture into different systems. Okay, so what is a safety case? It's not a document. It's more a set of documents where we put the claims and arguments, and we provide the evidence to show the stakeholders that our system is safe to operate. So we include the major hazards and the control measures. We include the safety management systems that are in place and are required to implement these the control measures, and also the emergency planning arrangements. So it's for everyone. So not only for the senior management, regulators, or operators, it's for everyone. So it has to be clear and easy to understand, not only for people in the facility, but also even to the public. So normally consists on these 5 steps. Of course, it varies depending on the project, but you first want to identify which are the hazards in your system or in your facility, and then you want to determine which are the consequences. You can do that by using different methods like hazard and operability studies and so on. Then once you have these hazards, you know what are the consequences, then you want to do a risk or a hazard analysis just to see how risky is your situation, how risky is your system, and how dangerous could it be. we do that through different methods. I will speak about some of the methods in this very briefly in this presentation, and then okay, we have all our results, which we gather our evidence. We say, okay, this is the level of risk we will be managing in our system. We produce then our safety case documentation, and this is a live document, so it has to be implemented, maintained, and updated throughout the life span of the project. So it starts from the concept design of the project till the decommissioning. It should be done until the decommissioning, and there are different stages of the safety case. Okay, so I think it's enough of what is safety case. So now what I want to explain is what is fusion. So differently from all the plants that are currently working at the moment, which are trying to break atoms and produce energy out of them, what we want to do is fuse them together. So put them together, and that reaction will create a heavier atom that will release energy, neutrons, which are very dangerous, and because they can make other materials radioactive. It's not that they are radioactive, also make other materials radioactive, and that's very important in our institute. And also it releases energy, of course, that can be used potentially maybe in 30 years to produce energy. Maybe less, hopefully less. There are different ways to have nuclear fusion. One of the most common ones, well, the one that we use all the time now is the gravitational fusion. So the sun is producing nuclear fusion all the time to produce energy. At the moment, we are working in the UKAA with what is called magnetic confining fusion. What this means is basically we have huge magnets in a shape of a donut, and inside that donut we have gas that is super hot, and inside that gas is where the fusion is happening. There are other ways to create it using lasers or using some other methods. So yeah, the Atomic Energy Authorities, we are trying to research. We are researching how to do fusion and how to do it safely. Yeah, the gas that we are handling in the UKA is around 10 times hotter than the surface of the sun. So that's around 150 million degrees Celsius. So it's quite a hot gas, and we need to be careful when we are working with that kind of material. So the main hazards are, of course, the plasma, or this hot gas, because it can produce, as I said, neutrons and also gamma rays, which is radiation, and also the external radiation that can be isotopes of hydrogen. Hydrogen is our fuel. Because hydrogen is a gas, it can just go away, and it can go through walls and through pipes very easily, because it's the tiniest molecule, and that can cause a radioactive kind of environment around it. So we need to be careful when we handle this kind of materials. Also, we have industrial hazards like like the normal ones, non-ionizing, like lasers, electrical fire, but also here is a bit of the human factors fact that I think is not as we are not giving as much importance as we should. We are considering as only drop loads and working at heights. So we're trying to kind of increase this awareness of human factors, and yeah, just to be able to kind of understand and design a safety system, we need to understand what are the potential sources of our hazards. So what we do is kind of produce a list of events, potential accidents that can occur in the facility, and then analyze each of these hazard scenarios, as we call them, and analyze what could be the consequences of that. So, okay. So what do we do in terms of human factors? So we want to kind of try and identify which are the layers of protection that should be in place to avoid having an accident that will involve a human interaction between the system and the operator, how to prevent those kind of accidents. So we need to kind of put different layers of protection. So as Colleen and Nora were saying, everyone kind of has their own definition of human factors. At the moment, we're following the one issued by the Office for the Nuclear Regulator, which is basically trying to understand the aspects that affect the human performance and minimize the potential for human error. That is negative. There is this negative connotation for human factors, but the human error to contribute to the escalate of the faults. Of course, these human factors need to be taken throughout the whole development of the safety case to kind of analyze which are the scenarios and what is the impact of the human in the system and the other way around as well. So we need to understand very well what are the interactions between these two main components, the human and the engineering systems, and what could be the actions that might impact in the safety, and being able to clearly identify those impacts. The ONR has issued a guidance on what are the categories of human factors that we should look at, that go from human reliability to user interfaces to also legislative, staffing levels, personal competence, and so on. Also the design of the procedures in case of accidents. So all of that is described in the ONR guidelines. I will be talking just about these two, human reliability and user interfaces, a little bit, these two categories, because it's too broad, I would say. I think human factors is a really broad field. So what is a human reliability assessment? So what we want to do is identify and analyze the human actions and administrative controls that are necessary for ensure safety in our facility. So that goes from the pre-fault human actions during any procedure in the system, maintenance, operation, and even commissioning, decommissioning, and so on. And the calibration or testing activities that could result in an unavailability of the system, or also interruptions probably in the operation of the facility. And the actions that can contribute to the initiating events. So initiating events are those actions that will result in having a hazardous situation. For example, leaving a valve open that will then cause asphyxiant atmosphere, those kind of things. And then we look at the post-fault, the human actions, and the long-term recovery actions when there are severe accidents. Fortunately, in fusion, we don't have those accidents yet because we are not working, maybe, but hopefully not. We are learning a lot from fusion. Okay, so to try to, as I mentioned before, we wanted to understand what are the hazards in our facility, and as part of that process, we do what is called the task analysis. So it's literally going to the operators and asking them, okay, describe what you do there, and step by step, and what are the main tasks that you perform there, and then which are the subtasks, and so on. So there are different ways to kind of analyze that. There is a hierarchical way. There is also the tabular way. and just basically capturing that information first. I think a method that was developed by the UKEA was what is called the SHERPA, so Semantic Human Error Reduction and Prediction Approach, which was kind of a hassle. So going to operators and say, okay, describe what is the task, what could be the potential errors that can result from that task, which could be the consequences, and if there were any safeguards already implemented in there to prevent those consequences, and if there were any severe damage, what could be the recovery actions, and then some recommendations. So this is done at different stages of the facility. And as I said, we always have to be looking at the design and trying to find some improvements in the design. So once we know which are the tasks and the potential consequences that can result from those tasks and those activities, then we want to quantify how often they happen. So that is where we have this concept of human error, unfortunately, human error probability, which is basically trying to understand, how often we will have an action that will lead to a hazardous scenario. There are different methods. Some of them are more quantitative than others. There is one that is quite frequently used in nuclear is THERP, so the technique for human error rate prediction, which basically is a graphic, kind of a tree graphic in which each of the branch represent the actions or the safety measures in place that will prevent having a hazardous scenario. And you see that in each level there are two branches. So one branch is what happens if the measure works and what happens if it doesn't, in terms of what is the consequences and what is the probability of that scenario happening. So that's very useful because it allows us to understand the dependencies between the safety systems in place, machines, but also the human or the key safety actions that the human will or the operator will perform in there. There are some other methods like HERD, which is I think already was mentioned by Colleen. So it's more focused on the tasks. So we define what are the main tasks that are performed. We assess, we kind of give them a base probability. And then we analyze which could be the error that can worsen or get better conditions for that task. So basically, what could be the errors that could happen in those tasks, and then we assign a number there, a weight. That can help us to kind of identify which task is worst or not. Then we calculate our risk, saying, okay, if we are in the red region, which is unacceptable, that means that we need to implement more safety measures and probably, more safety measures. And then if we are in the safe region, then we can continue. In case we are in the unacceptable region, we use different analysis methods, for example, the bow tie, which allows us to kind of see first what could be the initiating events that will lead us to a fault. And then what can we do to prevent those events? And then let's say that happened, then how can we react to that? How can we mitigate those consequences and put in place different barriers or different controls that would help us to reduce those consequences? We can, okay, I think I will skip this slide. So in conclusion, So as I said, safety case is it goes hand to hand with the development of the projects, and we should be including more human factors in the process of safety case to understand the interactions between the human and the engineering systems, and also to understand what are the human actions that will impact positively or negatively in the safety of the facility, and also the safety of the operators and the staff working around, and also the public. And how can we support the human in kind of having better working conditions to avoid these kind of scenarios. And I think as Nora mentioned, it's very important to have this open channel of communication between the safety assessors and the human factors experts with also the stakeholders, because sometimes, yeah, they say, okay, we want a machine that does this, this, and that. This is the budget, but then they send it to engineers, they design something, and then when the operators want to work with it, it's confusing or it's hard to understand and those kind of things. So it's very important to have this communication. That's it. Thank you.
Thank you.